Hello there, coders, future coders, and friends. We are back with another medical coding review. Today we are actually going over the path and lab section. If you're new here, this video is part of a series that I am doing on medical coding review, kind of aligning it with more so the CPC curriculum. So we're going to cover path and lab today. We're going to talk about what codes might be involved in path and lab, specifically questions you might see on an exam such as the CPC, some key concepts, and then we're going to go over a few practice questions as well. If you are new here, hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, highly encourage you to subscribe, hit that notification bell so you can get alerts when I post new episodes. The path section in CPT is not super large. So first we have our organ or disease oriented panels. So things like a lipid panel for cholesterol, or general health panel like you would typically get during a routine physical examination. We have presumptive drug class screening, definitive drug testing, definitive drug classes listing, therapeutic drug assays, evocative or suppressive testing, consultations for clinical pathology, urinalysis, molecular pathology, Tier 1 molecular pathology procedures, and Tier 2. Then we move on to genomic sequencing procedures and other molecular multi-analyte assays with algorithmic analyses, chemistry, hematology, and coagulation, which are tests that are performed to test how fast a patient's blood clots. Then we have immunology, tissue typing, transfusion medicine, microbiology, anatomic pathology, post-mortem examination, and then a few more cytopathology, cytogenic studies, surgical path, in vivo lab procedures, other procedures, reproductive medicine procedures, and then proprietary laboratory analyses. With the proprietary lab, if you notice on there, they end in a U. So sometimes you'll see that and think, oh, because of that, is that going to be in our category 2 section or our cat 3 section? But it's actually in our path and lab section in CPT. A couple of terms to understand for this section. Quantitative measures how much of a substance is present, like how much cholesterol you have or how much of a drug you have. Qualitative just measures the presence or absence of a substance. So do you have cocaine in your system or do you not have cocaine in your system, for example? Or it evaluates cellular characteristics such as morphology. Now, gross examination, if you hear the term gross examination, that means they're inspecting it without using like tools like a microscope. They're just looking at it, determining approximate weight or smell or things they can kind of see and determine without having to process it under a microscope. A panel. So a panel is a group of tests that are routinely ordered to determine a person's health status. Now we can only bill for a panel when we've done everything that's in that panel, and we can't overlap if we're billing 2 different panels. We would bill one panel and then whatever those extra components are. So for example, if you look at 80053, there's a lot of different codes that we could bill out individually, but these are all encompassed in just this one panel. So if we do all of these, we just bill for the whole panel. If we did one other extra code, we would bill this panel and that one extra code, but we can't overlap. So for example, if we look at 80047, a lot of these codes overlap, except for like the calcium ionized is different here versus here where it's the calcium total. So say we did everything that was in this panel, but we also did the calcium total, we would bill everything and then the calcium total. Or say maybe we did everything that was in this panel, but like one other test, we would just bill out that one extra other test and this whole panel. So we only bill the panel when we've done all of those components that are in that panel, and we don't bill 2 panels that have overlapping components. If we do that whole panel and something else extra that's not, another entire whole panel, we can bill that other additional lab testing component separately in addition to that panel. So don't break apart a panel when we've done everything in that. Also be very careful of these terms or. So if it's either we're doing this one or this one for this panel, either the CBC automated and automated differential white blood cell count or 85027 and 85004, or we're doing this one. So it's not both, it's or. So you might want to like circle or highlight that or so you don't make a mistake there. Let's talk a little bit about CLIA. CLIA is the Clinical Laboratory Improvement Amendments. And basically it says that there are a small amount of lab tests that a provider can do in an office setting. But in order to do so, they have to apply for a CLIA waiver with the Centers for Medicare and Medicaid Services. It allows physicians to do very simple to interpret tests within their office and bill for them. So things like a urine pregnancy test where you either have a positive or a negative result. So the provider has to enroll in the CLIA program. They have to follow the manufacturer's instructions when performing the test. And there are about 80 different tests under this waiver. And there is a CMS website that if you need to find out what tests are CLIA waived or not, you can go on there and they give you a listing of them. But for those, you use modifier QW, and QW for Medicare is the Clinical Laboratory Improvement Amendment, the CLIA waived test, and that's how they designate that that was a CLIA waived test. Now, ABNs, I may have covered this in one of my other presentations, but an ABN is an advanced beneficiary notice. And they're commonly given for things like lab tests because there may be certain criteria that insurance might cover it, they might not cover it. So advanced beneficiary notice means it's given to the beneficiary to give them notice in advance of them having that procedure or getting that lab test. So saying, hey, maybe your insurance only covers one of this a year or two of this a year, or because you were already diagnosed, we can't screen you for it. We can't give you this type of test. So they might not cover it. So the ABN is given to the patient before the service is rendered to notify them in lay terms what the procedure or service is, the approximate cost of it. And then they have different options that they either, they still want it. They want you to bill Medicare, but we understand that if it's not covered, I'm going to be liable. So once the ABN is given to the patient, then if Medicare doesn't pay, the patient has already been notified that they will be responsible for that service and what the cost of it is. Having that ABN on file is what allows you to then recoup that payment from the patient. So let's go through a couple of questions. A test that is performed at a site with a CLIA waiver must have which modifier appended for Medicare? CW, CA, QA, or QW. Now, do you remember where you're going to find some of those modifiers that you can't find in CPT? Where are they going to be? They're going to be in your HCPCS Level 2 book, right? Now, with the modifiers, there's not really a way to look up what a modifier is out of the listing of them. Just get familiar with what is in here so that you can hopefully find them easily. In regard of this with the CPC exam, when we're narrowing them down from 4 different answers, that is helpful because, it's not like we have to figure out what they are from the list of all the modifiers on here. We can just go down the line. So there's a CA. CA is a procedure payable only in the inpatient setting. That's not it. CW. Well, it doesn't look like there's a CW. Hold on. I'm not seeing one. Yep, no CW. So we've got QA and QW. I'm not seeing a QA. I am seeing QW. There we go. CLIA waive test. So this one would be our option D, which is our QW for the CLIA waive test. If you remember that, W for waiver, so waiver on file. So Q kind of sounds like CLIA. CLIA. So CLIA waived is the QW modifier. Next, we have a patient presents for an HIV screening test without symptoms. Test comes back negative. What ICD-10-CM code should be used? And it looks like we have a bunch of Z codes, Z13.9, Z11.4, Z21, and then R75. So let's go to our ICD-10-CM book, and we're going to look under the term screening. And then when we go to screening, we're going to go to HIV, screening, human immunodeficiency virus, HIV, and where does that take us? I'll zoom you guys in. HIV, we are at Z11.4. So we can verify that in the tabular, and it will verify that it is the correct code, Z11.4. Next, we have gross specimen description. We received a specimen labeled muscle biopsy trapezius, measuring 1.2 by 1.3 by 0.5 centimeters. Microscopic description. The muscle specimen demonstrates normal pathology. What CPT code is going to be used for this pathology? We have 88304, 88302, 88305, or 88307. So these are our surgical pathology, and we're going to be looking for one of what is this? This is a muscle biopsy, a trapezius muscle biopsy. So let's see what we got here. We don't have to do all of them. We just have to do one of the procedures listed under here to constitute that level 4 surgical path. So 88305 would be the correct answer for this one. Now we have a 62-year-old patient with AFib is ordered a lab for total digoxin. What CPT code should be utilized? So if we look in the index under therapeutic drug assay digoxin, it gives us 80162 or 80163. So if we look here, we have 80162 digoxin total, and then 63 is our free. Which one did we do? We did a total, which means we did that first code, the 80162 code, which is our option C, 80162. Hey, so you did awesome. And remember, this is a part of a series. So if you need to go back and review any other sections, this is actually part of a whole playlist. This is the playlist you definitely want to check out if you're looking to review for the CPC. I will see you guys in the next video. And until then, just keep on coding on.